Begin with breaking news. A little over 3 hours ago, health officials said they found the first measles case in Connecticut this year.
The virus has been spreading across the country this year. According to the CDC, the U.S. has already topped 2,000 cases, and it's only June. To put that into perspective, last year we saw fewer than 2,300 total cases. NBC Connecticut's Melissa Cooney is joining us now. And Melissa, what can you tell us about this case that was found here in Connecticut?
Well, the Department of Public Health says that this patient is an adult who recently traveled internationally. That adult showed symptoms after they returned here to Connecticut, and the patient was not vaccinated. This is the second case of measles we've had in 5 years. The last was in December with another person who was unvaccinated and traveled internationally.
And then once they were here in Connecticut, they started to develop symptoms. And at that point, they sought out care and it was identified to be measles. So I think, this is continuing a broad trend of what we're seeing around the country where we're starting to see measles cases uptick.
Dr. Scott Roberts at Yale New Haven Hospital says this is the most contagious virus we know about. The CDC says 9 out of 10 unvaccinated people who encounter measles will get it too.
They talk about things like cough. They talk about conjunctivitis, runny nose, fever. We did talk about the rash. There can be spots that can appear on the inside of your mouth as well.
The Department of Public Health says the Connecticut patient has a fever, sore throat, a cough, diarrhea, runny nose, and a rash. Dr. Ulysses Wu with Hartford Healthcare says the only treatment for measles is prevention and that the vaccine is safe and effective.
It is a very efficacious vaccine as well. This is a disease that we really should not be seeing anymore.
If anybody is unvaccinated or they're not sure, now is a good time to refresh that information. Check with your doctor, double check your childhood vaccine records that you did receive the measles vaccine.
The good thing about Connecticut and this case in particular is that it wasn't contracted here in the state.
Fortunately, the risk in Connecticut is much lower than most other states just because we have a baseline wall of immunity that's really high. Our childhood vaccination rate is above 95%.
The Department of Public Health says the patient is in the hospital right now and that their travel is not associated with the World Cup. Guys.
All right, Melissa Cooney, thank you.
Startling case there, Melissa. So if you have our NBC Connecticut app, you already saw it today, a push alert about this measles case a few hours ago. Download the app. We'll send you more alerts as soon as we get them and any updates from health officials, too.